Hi everyone, welcome to our channel, Thai Food for Tater. So if you're watching this video, hopefully that means you've watched the other videos that I've made. So for those of you maybe who are new to our channel, my name's Alicia. The other member of our channel is Laura. Sometimes we do videos together, sometimes we do them separately. But like I said, if you're watching this one, it means you probably have watched the other ones in my series. If you haven't, I suggest going back because it's kind of, I'm doing like along a timeline. So the first video I discussed being diagnosed with cancer, and then I did 2 videos on chemotherapy. So now I'm going to do a video on the surgery, or I should say surgeries, because I ended up having to have 2. So, like I said, if you had watched the other videos, I talked about being diagnosed and how difficult that was, and then going through chemotherapy was a lot going on, physically, emotionally, so much so that I made a part 2 after I made part 1, thinking I talked about everything. And in reality, I could probably make part 3, 4, 5. Like, there's just chemo's a lot. But, maybe I'll revisit that subject a little later, but I wanted to kind of move on in terms of like the timeline. So like I said, this video will be about the surgery. So where to start? When I first was diagnosed, my oncologist said, typically what they do is they do chemotherapy first. They want to shrink the tumor, so before they do the surgery to remove it. So that way it's less. Depending on the individual and what type of cancer they have. But for breast cancer, they want to try to minimize the amount of trauma to the body. So getting it as small as possible is always the first step. But right when I got diagnosed, there was. This is probably the story of a lot of people. They had to go back and forth with the insurance for a little bit. What seemed like forever in reality was probably like a week, maybe, if that. And so they had me started on chemotherapy first. And then, I had to wait a certain amount of time after chemotherapy because they have to make sure, you are like, your immune system's kind of ready. And also that you've had a time just in general, your body, your mind, to just have a short break. But they also don't want to wait too long. They don't want any more growth to happen after, the chemo. So I had to wait, I want to say it was a little over 4 weeks. It was like 4 weeks and a couple days. It was about a month, which is like the standard. So I had already known that. I had gone in for like a consult with my surgeon. Actually, before I even started any of my treatment, at the very, very beginning, I met my oncologist and I met my surgeon. And they were kind of working on a game plan, like all of us were, about, okay, what are we doing first? Chemo, okay, then we're gonna do surgery. And so I'd already met her, and she was amazing. I was very lucky. I think I might have mentioned this on the previous one. I'm not sure, but all of my physicians except one were female, which was really great. So my surgeon, I met with her initially and got to know her a little bit, and then after I'd done chemo, then I got to meet with her again, and we talked about everything. Now my oncologist had said, because I have for some patients with breast cancer, they will highly recommend getting a mastectomy, just depending on like how invasive the tumor was, how large, the size of your breast, where it's located. There are many factors. And for mine, when I initially met with my surgeon, she said we caught it was only stage 2, stage 2. But she said, it's like more a moderate size, so hopefully the chemo will shrink it, which it did. It shrunk it at like a decent amount. Not a huge amount, not as much as some, but some people go through chemo and it doesn't shrink it at all. So I was lucky that mine did. And so I'm meeting with the surgeon, after I met her, right away, and then I'm meeting her now that chemo's done, and we're talking about going forward with the actual surgery. We're having this conversation, and I told her, I said, well, my oncologist told me she had recommended a mastectomy, because I think my oncologist was being just better to err on the safe side. And for those of you there's a couple things. There's a lot of things I want to say about this, and I'm probably gonna have a lot of like side stories, but this is one thing I want to say now before I forget, is that I think people have a horribly misguided misconception about reconstructive surgery for breast cancer and getting a mastectomy and then the reconstruction. It is not the same as getting breast implants. So I know people have so I didn't have a mastectomy, but I had to weigh those options, so I got to a lot of information. And also the women in my support group who have had mastectomies have dealt with this people saying, oh, you get a free boob job. It's like, are you kidding? Like, I had to have a part of my body amputated, and now I have to have multiple surgeries to fix it. it's not the same thing as going in for a breast implant. It's not the same. Like, there's so much more to it. And so, but people, like, I think sometimes, not everyone, I think some people are just assholes, but I think sometimes people are trying to be lighthearted about it and might make a joke, not realizing how rude it is. But if that's you, please don't. Like, no woman wants to hear that, and it's horribly misinformed. And it really makes light of the fact that this woman's fighting for her life, you know. If it's to the point where she has to have a mastectomy, you know, it's bad. And you know, I had women in my support group, women I've talked to online in my online support groups who are my age or younger or older, and you know, they have passed. They have passed in the time that I've had cancer. Like, women I have known have passed. Stage 2, stage 4, like, you know, different, like, so, like I mentioned in my previous video, this idea, I don't think I elaborated too much on it, but I guess I'll just kind of say it now. This idea that breast cancer is the easy cancer is completely incorrect. In fact, it's one of the most difficult cancers. It's one of very few where you oftentimes have to have a part of your body removed. The amount of times that breast cancer affects your other parts of your body, like your lymphatic system, which I'll definitely talk about that when I talk about side effects. It's much, like, that's less common in other types of cancer. And because it's related to your reproductive organs as a female, it can often cause so many other problems with like just the whole system. And so, like, I don't want to get too far into that. I'll talk about that in a side effects video. But just know this idea that breast cancer is the easy cancer is completely wrong. And I'm just saying, like, I've had breast cancer, that's my bias. Like, I'd be the first to admit, oh, I got a little, you know, lucky. No, absolutely not. In fact, like, and this is the case that I've talked about with professionals that I've worked with who have dealt with people with multiple types of cancer, not just breast cancer. And they have very clearly said, like, in their experience and just based on the data, that breast cancer is often one of the most difficult in terms of surgeries and recovery and complications. So, you know, keep that in mind. So anyway, so I think my oncologist, back to the weighing what I was going to do surgically, I think my oncologist was thinking it's better to just remove them because you never know. And my surgeon, when I went to talk to her, you know, because I was ready if she had told me I think a mastectomy is the way to go, I wouldn't want to do that, but I would do it. And so she and I talked about it, and she's like, you know, we're very lucky that now there's a very standardized way of doing this. If you get a double mastectomy, we have everything set up in place that it's like a scheduled series of, like, procedures and surgeries to do the reconstruction. She's like, we care about you as a patient. We want to make sure you feel whole as a woman in whatever way that means for you. Some women choose not to do reconstruction because it's so complicated, and some women do. And so she and I talked about that. She's like, so if you're worried about, you know, losing your breast, we have a whole standardized process that we could, you know, reconstruct it. I was like, okay. But then as we're talking about it, you know, she's looking at my scans and the reports, like, the tumor's clearly shrunk. And I was very lucky that, I think I mentioned this in a previous video, that my tumor was on the lateral side, so the outside of the breast wasn't very deep. And so she's like, my expert opinion is we can just do a lumpectomy. So basically they're just going to go in and remove the lump, and they don't need to remove the whole breast. And so she asked me what I wanted to do, and I said, well, you know, my oncologist is suggesting mastectomy. And also the other thing is, when they typically do a mastectomy, they just opt for double mastectomy. Take them both, reconstruct them both, so you're even, and then, you know, if there's a chance of it coming back in the other breast, like, you've eliminated that significantly. And so I told her, I mean, like, well, what because I'm a numbers person, I'm like, what are the numbers? Like, are my chances of, you know, better if I do a mastectomy than a lumpectomy? And she said, based on your type and the size and the location, she's like, I would say it's not even a big difference. She's like, getting a mastectomy is not going to substantially increase the chance, like, that it won't come back. I was like, okay. I mean, because obviously in my mind I'm thinking I just want the lumpectomy, you know, but I'm thinking if the mastectomy's the better option for me health-wise, I'll do it. And she, you know, she was very clear. She said, in my opinion, I think that the lumpectomy is perfectly fine for you. She's like, if you really wanted the mastectomy, I would respect that. She said some women just opt to because, you know, she's like, but, and I think I mentioned this in another video, I had the genetic testing done, and I was negative for, like, none of those breast cancer genes were, like, turned on. And so she's like, or she said, you know, if those had been turned on, then I would probably say, even though your tumor was small, you might want to go with mastectomy just because of that, like your chances of it coming back. And then in the other breast or another part, she's like, is a little higher, but you don't have any of that. And so we agreed, lumpectomy was the way to go. And so it was going to be removal of the tumor and also removal of the lymph nodes. And so she said, from what we can tell in the scans and the biopsies, it looked like only 2 of the lymph nodes were affected. She's like, so we're going to plan on that. But just know, there's like a procedure they do like pre-surgery, I'll talk about that in a second, where they kind of try to verify. And so, she said, sometimes we don't know until we get in there if it's affected maybe 1 or 2 more. So just be aware that when you wake up from surgery, we might have had to remove more than just 2. And so I was like, okay, And also they removed my port. So I mentioned this before, I had that port implanted, and I didn't really go into the details of the problems I had with it. Like it worked fine, but you're not supposed to really feel it in terms of like, it's not really supposed to bother you on a daily basis. Mine, whenever I would lay on that side, I felt this weird nausea. I'd get like this weird, almost like I feel like I was gonna pass out, but I'd be like laying down. It was a very awkward feeling. It was just very uncomfortable. And I mentioned it to my doctor, and they said, well, it's like attached to your vein. And so none of it was like outrageous. They were like, oh my God, something's wrong, And they clean it and flush it every time. And so they're like, it's working properly. There's not a problem with it. And I was like, okay, it's just one of the things I have to deal with. But when they said during surgery, do you want to have it removed? Because some women opted to keep it in for like 2 or 3 years in case the cancer comes back. They don't have to get it reimplanted. And I was like, take that thing out. Like, I don't want that in my chest anymore. If I have to get it implanted again in 5 years, I'll do it. But I want this thing out of me. And so I went into that first surgery knowing that I was going to get the lump removed, the cancer, the lymph nodes, and then my port. All of that was going to be taken out. So I was like, okay, this is going to be a lot. And I try to make these medical videos like under 30 or around 30 minutes, and I'm looking at it, I'm like at 12 minutes, and I already know, I'm like, I have so much more to say. Like, this is just the preface to like the surgery. So we also want to say, I want to say I had surgery only one other time before this. I had a surgery on my leg about a little more than a year before the breast cancer surgery. It was my very first experience going under. It scared the crap out of me. I hated it. And when I woke up from that surgery, the pain medication they'd given me wasn't working. And so and I talked to the anesthesiologist about that was the previous year. And so when I'm going into this surgery with the breast cancer, I told my surgeon, look, I've only had one experience with surgery, but I know that this was an experience I had. It was very painful because they had given me, let me think, for the leg surgery, they gave me Dilaudid, and it did nothing. And I've had no experience taking these medications. It's not like I had a tolerance or something. Like, they gave me Dilaudid, it didn't do anything. They gave me morphine, and it didn't do anything. I didn't feel anything except just pain. And so they had to just send me home, and they sent me home with Vicodin. And once I think got past that like first day of the horrible surgery pain, the Vicodin helped for the 2 weeks I was on it for like the healing pain. That worked great. So it was just very strange because they're all kind of similar. Like, I'm not an expert in the drugs, but they're all kind of similar. And so my body was clearly reacting to one and not another. Anyway, so I told my oncologist or the surgeon this for the breast cancer surgery. I'm like, I'm kind of worried because of the pain. And I had a horrible experience about a year ago, and I don't want to go through that again. Obviously, I know we have to do this, but I just wanted to let you know because I don't know what that means or if that means anything. But maybe don't give me that because I don't think it's gonna work. And so she's like, okay, I'll make a note to your anesthesiologist, and we'll talk about it on that day. I was like, okay. So now fast forward to it's the day of surgery, and I have to get to the surgical center like really early. My mom was there with me, and yeah, I'm nervous. I'm so nervous, and this is very frustrating. So as a female, for those of you who are watching who are female, you are aware of this, that often when you go in for certain procedures, especially surgery, they will ask you if you're pregnant or if you could be pregnant. And because I think in their minds, most women, if they were pregnant, they wouldn't go through with the surgery. Now, for myself, I actually, 4 years prior, had a sterilization procedure. I didn't want kids. I've known, like my own biological children, I've known since I was young I didn't want to birth any children. So I made that permanent in 2014. And so I can't get pregnant. And so when they're asking me these like standardized questions the day of the surgery, you know, I'm like in the back, I'm like in the gown, and I'm miserable because I'm still recovering from chemo, and I'm just so scared, and my body is hurting, and you know, I'm just like, I want to get this thing over with, and it's just, you know, very uncomfortable, and it was early, and it's, you know, so I'm already just stressed, and I'm stressed and in pain. And so they're asking me these very standardized questions, and they're like, is it possible you're pregnant? And I was like, no, I'm sterilized. And they're like, okay, well, we're gonna do, you have to go to the bathroom we have to verify this with the pregnancy test. And I was like, no, that's bullshit. I said, one, you should have told me that before you called me in 20 minutes ago, because I peed in the lobby. I mean, I didn't pee in the lobby. Like, you know, I was waiting in the waiting room, and I used the restroom because I was in there. They were running behind, and I was like, it was like 7 a.m. and they were already behind. So we were sitting out there for a bit before they even brought us in. So I used the restroom, because why would I not use the restroom before my surgery? And so I was like, one, I don't have to pee. I literally just peed like 15 minutes ago. And I said, and I told you I'm sterilized. I can't be pregnant. And even if I were pregnant, I would say, it doesn't matter to me. This is my surgery for my body. I'll deal with that on a later date. I said, so I'm telling you now, whatever this test says isn't going to matter to me. Does it matter for the surgery? And they were like, well, no. And I'm like, then why are we wasting our time? If it's not going to affect the outcome of the surgery, then I'm telling you now that as a patient, like, I don't care. And so I'm like, plus it's impossible. Like, I'm sterilized. It's like 99.999%, you know. And plus the chemo, like, was, you know. Anyway, so like, they're giving me a hard time, and I brought in, or they brought in the anesthesiologist, and we're talking, and I was like, look, and also like they have this one bathroom, and like I'm already having a hard time walking because I'm still really weak from the chemo. I'm like, I don't want to have to walk all the way over there. I'm in a dressing gown, like I'm naked underneath. Like, everything hurts. I don't want to walk. Please don't make me get up and go to the bathroom. I don't have to go, you know. And so I'm talking to the anesthesiologist. So later, they finally were just giving me a hard. There's one particular nurse was so rude about it, and she basically was like, well, we're not going to do the surgery unless you pee. And I was like, this is bullshit. I'm like, I'm going to pee, and then I'm going to complain about this later to someone. So I go and I peed like the tiniest amount, and then of course, you know, it was negative. And later on, I was talking to the anesthesiologist, who was great. He comes in, you know, and talks to you before the surgery. He's like, we're prepping. We're gonna be doing surgery in like 10 minutes, so I'm just gonna chat with you about a few things. And I brought it up, and I was like, look, let's just say the random crazy chance I was pregnant, would that affect anything about the surgery for me? Like, will the why am I blanking? Will the any of the medicines you give me, the to put me under or to relax, will any of it affect me negatively if I were pregnant? And he was like, it won't affect that at all. It wouldn't affect the surgery in any way. I'm like, then why is this an issue? I'm like, if I were pregnant, as a female, is my right, I would have an abortion. I would schedule it for next week. Like, and I'm not, so I don't have to. One, that's why I got sterilized. So I know myself, and I wouldn't ever want children, and I wouldn't want, like, it's just complicated. It made it so much easier for me just not to worry about it ever. But I knew what I would do if I had to make any choice, you know, for myself. And so I'm like, you know, we wasted 20 minutes. And also we were, like, you guys were running behind. So now we're behind. I'm like, I'm already stressed. You can imagine I'm stressed right now. And I'm a little more heated now as I'm talking about it, because at the time I was just so tired. You imagine you're really, really weak and sick and tired. But I was trying to convey my frustration that as a female, this is bullshit. Like, guys just wasted 20 minutes, and I'm telling you. And he was like, you're sterilized. And I was like, yeah. He's like, what are you, what procedure? I was like, Esher. And he was like, oh, and I could tell he looked at the nurse. He said something. It's been 3 years. I forget his exact words. But basically he told him, like, why are you guys giving her a hard time? Like, anyway, so he was cool. And I told him, I'm like, this is what happened. I don't know if my doctor had given you the rundown about what has happened in my previous thing. And he said, okay, it's good to know. He's like, well, we're going to start you with Dilaudid, but we can start you on a higher dose. And we're going to give you something called Toradol. He said, the way he described it, he's like, it's like kind of like a really strong ibuprofen. And he's like, that I've seen with success with patients that kind of relaxes your body a little bit more, and that allows the medication to work a little better. And I was like, okay. He's like, so we can't always predict what's going to happen, but this gives you a better chance of waking up not being in pain. And we'll kind of make a note in case they need to give you more. I'm like, okay. So I go in, you know, they wheel me in. Oh, the other thing. I already knew I'm at 19 minutes. This is going to be a long ass video. Okay. So maybe I'll make a part two. I don't know. I want to try to keep it all in one video. But they have to do the surgery to avoid any kind, like, just opening me up and exploring. You know, they kind of know in general where it's at, but they have me go in. It's this radiology procedure before the surgery, like 20 minutes, 30 minutes before the surgery. And they go and they numb my breast. And they literally, they put a needle. They use the imaging and they guide it in. And they put a needle in, it's sticking out like a good 2 inches outside of my breast. But they put this needle into my breast and they put it right to where it's at the cancer. And so when they go in surgically, they can go right to it. But I'm awake. Like they're reeling me into this machine, this x-ray machine, and I have to sit there and my boobs and, you know, like you're getting like a mammogram and it's just there and I can't move because there's this giant wire. If I move, the wire's gonna catch. And I'm just like, oh my God. And they have to verify that, verify that it's in the right location, take open images, make sure it's in the right location. And then they put like a freaking like Dixie cup over it. And they wheeled me back to my bed where I was like, had to wait like 10 more minutes. And so I'm like, this is like, it's crazy. But it serves a purpose. So anyway, so they bring me into the room for the surgery, and the nurses, besides that one nurse, the nurses were all really great, like the surgical nurses, because they can tell I'm scared. I'm crying. Nothing's even happened yet. I'm crying. They're like, don't worry. And they give me the medicine. They're like, tell me about, what do you do for work? And I'm like, oh, I'm a teacher, whatever. And I'm fighting it. And she could tell. She's like, stop fighting it. Just, we've got you. They were so kind. She's like, we are going to take care of you. And like, I'm sure like most of you are aware, like, at least in my experience, when an older female tells you that, you feel this like, it's like a nurturing, motherly. I'm like, okay, okay. And so I went to sleep, woke up, it was like 3 hours later or whatever it was. I woke up in excruciating pain, like not the worst pain I've ever felt, but second worst pain of my life. And it's in multiple locations, and my arm and breast are just on fire, and they're waking me up, and they're like telling me, we just gave you medicine, you should be, I was like, I couldn't even form words, one, because I'm just coming out of, anesthesia, and, but also like the pain, like after the first 2, 3, 4, 5, 10 minutes, and then I'm waking up even more, the pain is just like, I can't even talk right now, think through the pain, it's so bad. And I'm trying to tell them the pain, it's so much, like, please God, like, I can do anything but just writhe in pain on the bed. And I'm just crying and crying. And just, how much do you tell them, like, it fucking hurts, Jesus Christ, I'm dying, like, that's how much it hurts, like, do something now. And so they gave me more medicine, they gave me more Dilaudid, and they're like, I'm like, it's not working. They're like, yeah, wait like 20 minutes. And I'm like, 30 minutes goes by, and now I'm even more awake. Now I'm like pretty much awake all the way, and the pain's just, and so they had to like call in the I forget what the medical term is, but the person like who's kind of in charge, for that shift, and they had to sign off on me getting like this more pain medication, and they gave me like more morphine, and they had to give me like oh my gosh, now there's so many medications. They had to give me this very specific type of Dilaudid. It was like IV versus like or something, I forget, but they had to get like this whole other procedure, and like they had to get a bunch of people to sign these forms, and meanwhile I'm just like dying, like please God. And I'm looking at this woman next to me in the bed. She had to come in, was waking up around the same time I was, and she's sitting there just like eating like a snack, and I'm like, I don't know what she had done, but most surgeries in general are painful, right? And she's clearly like, whatever they give her, why isn't it working for me? Nothing. And then the nurse I had this whole time was so rude. And at the time I was still kind of out of it. And so it wasn't until later I was like, oh, like, how dare you? And she's just like, oh, this girl probably just can't handle pain. And I was like, one, I can. I've been in pain for months now, thank you. Have you experienced that? But also, I shouldn't be in any pain. Like, I get that it's not going to take it away 100%, but it wasn't taking it away even 5%. I should have been comfortable. Maybe I would have been in a little pain, but I should not have been in that much pain. There's no way. And it's not her fault. I understand that the medication wasn't working, but clearly fucking do something. Now it's been an hour and a half. And then she got even more rude because my family came in, and I'm trying to communicate with them that it's, and my mom said something, and Mom, if you're watching, like, I think you and I might have talked about this before, it really upset me at the time, and my mom said something to the effect of, like, she has a low pain tolerance, and I just remember thinking, how do you know that? Like, you don't know, and plus, like, I don't, like, first of all, most females in general tend to have a higher pain tolerance than males, and I do have a fairly high pain tolerance, but also, multiple studies have shown that women are less likely to be believed when they say they're in pain. Like, it just had everything working against me. And so I'm like, well, I'm thinking, Mom, first of all, why would you say that in that moment? Even if it were true, which it wasn't. But even if it were, I was still clearly in pain, and that just gave more, ammunition to this nurse who already was like giving me a hard time. And then she said, well, because they're trying to get me dressed to leave. Because I'm only supposed to be like in post-op for like 45 minutes or an hour or something, and it's been like an hour and a half. She's like, well, you guys need to leave. If you don't get dressed, we're gonna have to meet you at the hospital. And she's like, you need to make a decision. Now, mind you, I feel like later, I feel like it was so unprofessional and unethical to ask me, person who just came out of major surgery, to make a medical decision about myself, about whether I should be admitted. And I said, I don't know. I don't even know what that technically means. Does that mean I can be admitted overnight? Do I have to stay a full 24 hours? Does that just mean I'm admitted into a room for like a couple hours where you monitor me? Also, does my insurance cover that? I don't know. And I was just like, I don't know. I guess I'll go home. And I'm just like, oh my God, And finally, I feel the medicine kicking in just a tiny bit, but mostly I felt it kicking in like, I don't know if you guys have experienced this where you're feeling like the mental effect of maybe a medication, or like it's really churning up your stomach. It's affecting your body, but it's not actually addressing the pain. That's what I was feeling. I was like feeling really nauseated, and I was feeling really lightheaded. And I'm like, okay, I think that's the medication, but the pain was still there. And so I was like, good Lord, And so they're trying to get me dressed, and so I leave, and I'm just like, this can't be real. And later, of course, later I was thinking about that nurse, and I was like, I was just so angry. She'd given me such a hard time, and for no reason. Like, I was in so much pain, and she was just like, oh, this girl can't handle pain. I'm like, no, like, you don't know me, and also I shouldn't have been in any pain. Why weren't you doing something? And I've had no history of taking any kind of medication like that. If she thought something negative about me, like maybe I had used drugs, which I haven't, but even if I had, like, she had no evidence of that. The fact is, I was telling her I'm in pain, it's not working, please God, I couldn't even think, and the fact that then she, after all that, had me make a medical decision. I should have been admitted. I found out later my insurance would have covered it. I didn't know that. I'm so angry about that. And so I ended up going home, and then they sent me home with Vicodin, and then of course that worked great. So it was like, what's going on? Like, after that first day of like getting through like the trauma pain, the Vicodin helped me. Like, I was still in pain, but I was like manageable. And so I saw my surgeon. Like, there's like, you have to do like a I think it's like 72-hour check-in. So I went in, and they check everything, and she's like, everything's looking good. And I told her briefly what had happened, and I said, not even just the nurse shit, but about the pain. I'm like, this is the problem I knew was going to happen. Like, what's wrong? And so she said, well, the way she kind of described it was, some people's bodies metabolize it like food and not like a drug. I don't even know what that really means, but that's how kind of she described it. She's like, your body's not using it the way it's supposed to. I'm like, oh, great, And I was like, well, is that indicative of something? Does like my liver not work? She's like, oh, no, just, you're a statistical outlier. It's just bound to happen to some people. And I was like, well, what does that mean for me? She's like, well, it just means whenever you have surgery, it's probably going to hurt a lot. I'm like, okay, great. And then we're looking at the report, because what they want to check for is they remove the tumor and they check for clear margins. Basically what that means is, imagine you're pulling out the tumor. If you're looking at the edges of the piece you've pulled out, you want it to all be non-cancerous, because you want to make sure that you pull out the cancer and any surrounding tissue, because if you pull it out and it's cancer, there's always a chance that there's still some cancer left in. So you want it to all be like non-cancerous, basically. You want to take the cancer and a little extra is the best way to kind of describe it. But one of the sides it wasn't clear, and so she's like, we have to go back in. And they had told me that before. They said it's about a 20% chance with these types of procedures, 1 in 5, that we have to go back in a second time. Second time's less invasive. They just open up the original, the incision, and she's like, and so she's telling me this, we're gonna have to go back in. So 10 days after my first surgery, I had a second surgery, and so it's like clinking, but she's telling me it's gonna be much easier, faster, less invasive, and it's not 1, 2, 3 things. It's just one thing. She's like, we're just gonna go and kind of clear that edge. So you back up, it's much more simple. But I still had to go under anesthesia, which I hated. And so I told her, I'm like, what are we gonna do about this pain? And she's like, well, the surgery should be much less painful. I'm like, yes, true, but. And so I had the same anesthesiologist, so he and I were talking that same day too. And I told him the whole story, and he was like, well, let's try. He's like, luckily, he kind of agreed with the surgeon. He said, this one will be less invasive. It should be less painful in general. He's like, but we'll do the Toradol again as a muscle relaxer. He's like, we're not even going to start with Dilaudid. That clearly didn't work. He's like, we're going to give you a higher dose of morphine. And because I told him the Vicodin didn't work, he's like, we're just going to give you some Vicodin to take when you wake up. And I was like, okay. He's like, this might just work better. And for whatever reason, I even asked him, like, Dilaudid and morphine. Oh, because I forgot the other thing was on that first surgery, when nothing was working, they were like, well, the next thing we can give you is, oh my God, what's it called? What's the when they give, I have to Google this in the middle of the video. What's the drug they give people who are recovering from heroin? Give me like 10 seconds to Google this. I don't know how to Google. Let's see. What is it called? Oh, this is gonna drive me crazy. I feel like it's on the tip of my tongue. Come on. Oh my God, now my phone doesn't want to work. Google, cool, right in the middle of the video. It's gonna pop into my head in a minute. Oh wait, was that it? No. Okay, one more time. Please, Wi-Fi. This is chemo fog, chemo brain right now that I can't remember it. I want to say it starts with an N. No. Oh man, this is embarrassing. Okay, I wasted like a whole like minute and a half on that. It's gonna pop in my head in a minute. But anyway, they were like, the only thing we can give you is this, and I was like, wait, isn't that what they give heroin addicts like to recover? Like that seems like really strong. Like if it, I don't even know if I want to. This seems crazy right now. And so, anyway, so we're fast forward to the second surgery, and so I'm talking to the anesthesiologist, and we have this game plan, and it works. Like I woke up, I was still in pain, but it was like I woke up being like a more like pretty uncomfortable, but not like screaming in pain like I had been. So that went well. And so I recovered better, but I like it was crazy because I had all these, like I mentioned in the previous videos, I had all these plans. Like I was going to stay, do all my coursework and stay working, and I was working hard to do all that, and then throw in like I was trying to schedule my life around that I had cancer, and looking back, I'm so mad at myself that I didn't take time off. I didn't take time off work or school in a real way, and when I know I had some options to like definitely de-stress my life in terms of like work and school, and I didn't take those options, and I regret it now. But at the time, like, well, I can't go back in time and change it, but I know it would have really, I think, helped me. But I was trying to fit in, the surgery so I could go to this conference, and then I found out that I had to have the second surgery, and so in my mind, like, the conference is almost more important. So, who cares? In the grand scheme of things, obviously, who cares? But in my mind, I'm like, I'm a grad student, I have to, like, do this conference presentation. And so I was, like, literally, like, in bed after my first and second surgery, recovering, and I had my laptop and I was working on this presentation, and I ended up sending one of like my academic poster. I sent it with a friend to the conference so I could still get credit, and I worked hard on this small project. I wanted to present this information, that I had researched, but it was just like, and one of those things, like I look back and think I'm very frustrated with myself that I didn't, like no one probably would have cared, my advisor, like, he was always like, whatever you want to do, if you want to do every conference, we'll do it. If you want to do nothing and you just want to take time, do that. Like, he was very, very supportive. And everyone else, most of the people in the faculty were as well. But, like, I still felt like I had something to prove, But I'm trying to think to wrap up. I don't want to have a part 2 of the surgery, I don't think, I think that's pretty much it. The surgery wasn't nearly as bad as chemo. And like the surgery is difficult, you have it that day and maybe there's like a week or 2 of recovery, but versus chemo where it's like 5 or 6 months or however long you have it, it's like way different. But the surgery and my scars, they were kind of more obvious at first and they have healed really great over time. And, they, like even this one, like this one was it's like obviously you can see it, but it was even like when you first have surgery, like everything's so inflamed, and it's really over time it's really healed really well. I have one on my breast and then one like in my armpit, and you can see them, but they're not a big deal at all. And so I feel very fortunate that I was able to, like I said, have just the lumpectomy and have to deal with minimal scarring. Although, I mean, I think I've come to accept the scars. There has been times, in these last few years where it's been very hard to accept them, and they're a constant reminder of what happened. But also, like, as a woman or as a person, when you have scars, it's easy for people to be like, oh, those are your battle scars. It's like, yeah, but that's an easy way to think sometimes, but sometimes you're like, I look mutilated when I look in the mirror, and even though they're not that bad at all, it can be hard as a woman to see your breast, something that's supposed to be part of, well, it's a huge part of who you are as a female, just biologically. But, as a woman in the world, as part of who you are in terms of like, attractiveness, or how you feel about yourself when you look in the mirror, or how you want your partner to see you, it can be really difficult, even if you're a really strong person and you have a great sense of, self and confidence, it can still be really, it can test that a lot. And so I definitely have experienced that. And, I know a lot more women who have experienced that in lesser or greater degrees, depending on whether they had, mastectomy or not. So it's really difficult. Okay, so I think that's pretty much it for the surgery video. I'm going to talk about radiation on another video, and I keep hinting at this throughout all these videos that I'm going to do one on side effects, because I try not to do too many side stories, because so many of them have to do with the side effects, the long-term side effects. I'm going to dedicate a whole video on side effects, because there have been so many from chemo, surgery, and radiation. So there's still a lot more about the surgery I'll talk about later, but this was, kind of it in terms of the actual procedure. And that heroin drug, I can't think of it. Let me think for 10 seconds. It's going to pop into my head. I'll find it and I will put it in the description box. So if you're watching this video now, you can look that, you can see, oh, she did find out. That's what it was called. And also if you're watching this video, you probably remember. Okay. So that's it for the surgery. And this was a decent bit longer than I was anticipating, but that's fine, And I'll see you guys on the next one when I talk about radiation.